Starting. So welcome everybody. I just wanted to thank you for taking some interest in this and meeting with Dr. James Petersen, who's the founder of Stressmaster International and a huge mentor of mine over the years for how to look at stress in a very different way and really taking very proactive measures in reducing stress and changing the way I respond to it. So those are some very key things.
You've done great.
I think it's been amazing. Because I was just a complete stress monkey before. Like I think I was on like 100% on stress all the time for decades. And I was really stuck. My nervous system was really hijacked. So it's been a really great way to integrate along with some other practices to help lower that stress response. And I know it's been really integral in, recovering from a lot of the fibromyalgia symptoms. It's been quite life-changing.
You've done well. You've done well.
Anyway, over to you.
I can jump in here and just kind of give what I'd like to do is a little bit of an informal presentation here. I don't have a slideshow to show you. I have information to show you, but it's more important for me to kind of just have a conversation with you about what you're doing and how what we're doing might fit into your program. But let me go back a little bit. Oh, we have one more person. Oh, we have two iPhones.
We have two iPhones now. If you guys know how to go into the participants list and you can change your name so we know who you are, that would be really great. Oh, we lost one.
I think it was the same person.
Yeah, I think so.
Yeah. Oh, was it?
Yeah.
Well, I don't know if she'd be able to come on twice with the
Yeah,
same.
I saw the picture and her iPhone was twice.
Is that right?
All right, we'll just go ahead.
Sorry, I'm trying to figure out the iPhone. Can you hear me?
Oh,
I'm really
Hi.
sorry. I usually do this on my desktop and I'm trying to do it from my iPhones.
No problem.
Some technical difficulties here. I will try to figure out how to add my name, but I'm Christy. Hello.
Christy.
Hi,
Okay.
Christy.
Hi.
Hi, Christy.
Welcome.
Sorry to interrupt.
No problem. We're just getting going here. And as I said before, this is an informal presentation about who we are, what I am, and what we're doing, and also what you're doing, and how the concept of integrating stress mastery, stress management into a health and wellness program is so very important. It is very clear to me now, after many years of working with associates like you and others who are in the health and wellness business, that we need to be doing more to help people with their stress, because it impacts all of wellness. What they eat, what they smoke, how they live is really key. So my goal has always been to help people find ways in which to live a healthier, stress-free life for greater health and productivity and greater relationships and better relationships. And so that's what this is all about. I'm going to go back a little bit in time here. Years ago, I had a clinic called the Stress Management and Biofeedback Clinic in Tucson, Arizona. And at that time, I had decided to focus on individuals with what we used to call psychosomatic problems. We don't use that term today. As a psychologist, we tend to avoid that because it has kind of a negative connotations. But during the course of my work and founding the clinic and working with people who had stress-related problems, anywhere from tension headaches, bruxism, TMJ problems, GI problems, that the physicians had said, this is, you've got some stress going on in your life, and you should go over to the clinic and see what we could do about it. Well, what I discovered was back in the 80s, so how long ago this has been, people didn't really have a good idea of how stress is really impacting them. We could talk about it generally, and we all can agree that defining stress is a very difficult problem. I mean, everybody has a different concept for it, but the bottom line is that people are uncomfortable, they feel bad, they have anxieties, they have even depressions and burnout going on in their life, and they feel a certain way, and we label that as stress. And we also know that stress prolonged over a period of time can really have a very debilitating and damaging effect to our body. So what I felt was important was that people needed to have a way to step back and look at themselves, not just talking about it and not just doing an interview, but really, how can we parse out some of the areas where stress may be impacting their life, which is how I came up with the Stress Mastery Questionnaire. So I discovered that as a psychologist, we're very good at creating assessments. If you go to the book on assessments, there'll be probably 10,000 assessments of all kinds. So I started to figure out what could we work on, and the concept of type A behavior had been bandying around that time, and everybody was talking about type A, highly competitive, very competitive individuals, time-oriented individuals. And I said, well, let's start there. Is that a good enough concept? So having worked with people, I decided to come up with a series of rubrics and questions within those rubrics that seemed to make sense. And by the end of the day, after about a year, I had a very long questionnaire, which is not a good idea. It was like 200 questions. So that came along a time where the University of Arizona Medical School came to me and they said, well, we're doing a program called Project Well Aware, funded by the Kellogg Foundation for the community at the medical center. And we need assessment tool. Can we use yours? And it was very embryonic at that time. So I said, okay, sure, why not? But they said, well, it's just way too long. So I got a team together and I said, we'll pare it down to something more reasonable. At the end of the day, we came up with something like maybe 100 questions or whatever it was. And they used it in a part of the program, and it was very successful program. They reached a lot of people in the community as part of this. It was very thorough. It was a multi-level, multi-tiered. They had multi-days. So I felt very good about that. And then they gave me some great feedback. And from that point of view, I began to pare it down a little bit more and then use it in my clinic. But what happened was, it turned out that it was some people in the business community, particularly the state of Arizona, the Department of Economic Security said, well, we're doing a stress management program for our employees. We heard about your tool. Can we use it? And I said, yeah, you can use it. So I gave it to them to use it, charged them a nominal fee. And they did about 600-700 people through their program. So that kind of led me to think about this. He said, this is not a clinical tool. This is not a psychological tool. This is a tool that is kind of an awareness tool, something that, as you guys have taken it, and if you look at the data in each of your reports, there's some kernel, maybe there are many kernels that resonate with you. And that's what happens with clients and patients. They say, well, I didn't look at it from that point of view. I didn't realize that yet they're responding, they're answering the questions about themselves. So the validity of the tool was very high and the reliability was very high. And at that point, I just made the decision that I created the concept of stress mastery in 1982. And I said, we need to talk about mastering stress, which, by the way, is not an absolute concept. I want people to know that stress mastery, from my perspective, is a path. It's not an absolute. We are on a path to stress mastery. We don't achieve stress mastery, probably never will, because we're all imperfect. We can't always be 100% just without stress. We have to have stress. And then at that same time, I got contacted by the United States government from the National Institute of Safety and Health, who had been doing a lot of work with companies because they were working with companies to help with stress at the time and still are. And they heard about the tool and they said, look, there's not much out there. We would like to fund you to do a validation study of your tool to see if we might be able to use it with companies and organizations around the world, around the country. So I said, okay, that would be great. I love money. Go ahead and fund me. Well, great. So they did. So we did a stratified random sample. We selected individuals from a variety of companies around the country, and we conducted this study, hired statisticians, did all the proper statistical analyses and so forth. At the end of the day, it turned out that there were 7 scales that particularly held together what we call with good content and not just face validity, but good content validity, and to some degree, some predictive validity, which is very important to have a predictive tool. But what we also understand, what I think I want to share with you is each of the scales interact with one another. Yes, each one looks pretty isolated, but they're really not. Yes, you might be high on anger or perfectionism, and that may be an area that you might want to work on or your client might want to work on. But they also interrelate because all tests are not pure. You cannot have something that is a silo where there's just one thing called anger, one thing called perfectionism. Tension interrelates with disappointment, interrelates with burnout, so forth. So, but again, the point was this: it was developed as a tool, not as a clinical tool, but as a tool for personal self-awareness. And I wanted to give you a background about this because I think it's the foundation for how I work with individuals, how almost all of my associates, we have 87 associates around the world, use this tool as a way to improve and expand what they're currently doing. And if that's something of interest to you, then I'm here to kind of talk to you about how that might become a reality and how we might work together. So there's a lot more that goes into it. We work with companies around the world, from South Africa to Saudi Arabia to Norway, and it's been translated into many languages. So it's a very versatile tool. It's not perfect, but in the hands of a good coach, a good trainer or counselor, it's great. It opens up eyes, it opens up ears, it opens up thinking. And if we use it from that point of view, not as a clinical diagnostic, but as a tool to become truly aware of some of the areas that I need to work on to make a change in my life, that we're making some progress. Having said that, does anybody have any questions?
I think you just hit all the points with each of the ladies that I've met with so far as well, looking at how to connect the dots and seeing sort of patterns and identifying for themselves, and it could be with their clients and patients as well. It gives a little bit of focus and directional to say, okay, well, what can I start looking at first? And it's still up to the individual, right?
Mm-hmm.
Like we're
Yep.
not telling them what to do. It's still definitely, but that awareness is key. And I've quoted you often, you can't change what you're not aware of.
Yep, it's true. So that's the foundation. There was another question. Somebody, Bonnie, do you have a question? I can't hear you. Unmute, please.
Sure. Can you hear me now?
Yeah, I can.
Okay, great. So you said this isn't a clinically diagnostic tool. Is this something, I have a functional medicine practice, I do longevity, I do healing, I'm a health coach. If I used this in my practice, could I be comfortable thinking that it is a diagnostic tool, or how would I utilize it in my practice, I guess is my question.
Well, I'm glad you said that. I'm working with a physicians group in Virginia. They have 3 locations. It's kind of a boutique physicians group. They have 3,000 or 4,000 people. And what they do, they integrate it into their evaluation. So they might have an executive evaluation, and they might run a whole variety of assessments with regard to that. But they also felt that they needed something that would help a person that was going through the battery to look at themselves from a second point of view or their own personal point of view. And what they do is, so we provide the SMQ to that individual, and then one of my coaches will do a discovery session and talk to them about do they see anything that they want to work on? What might that be? and how we might put that together. So I think if you use it from that point of view, not saying, hey, you're stressed, you had a high score, that's not what I want to do. I think really, really get away from that because it leads people in the wrong direction.
Mhm.
And so you've got a medical practice.
No, I'm not a physician, sorry. Even though
Oh.
I do functional medicine, my training is more as a health coach and a nutritionist. That's my
Okay.
background. So I'm not a
Okay.
physician. So I guess I would have to do the licensing program. I'd have to do the program with you, and then I would be the person doing it with my clients. Is that correct?
Right. Now, the way this segues into how do I work with my associates.
Yeah.
I'm very hands-on. I have no time anymore to go out and do programs.
Mm-hmm.
My goal is to facilitate and work with you. So for example, there's a lot of materials, there's a lot of resources that you may or may not need that are part of it. Like, how do we coach people? How do we do a training program? How do we do, if you're interested in marketing, how do you improve your marketing? So I'll get into the details of what is provided, but basically, it's a very close relationship with each of my associates. I'm always available, as Melody will tell you. If you have maybe a program or maybe you want to work with somebody, I'm here to help in any way that I can. Provide the materials, provide the training, whatever I can do. So that's the associate program. The license is simply a matter of giving you an opportunity to buy at a low rate. We sell directly to companies at a higher rate. So my goal is always to work through the associates, but if a company comes to me and say, we want to buy 500 for our employees, we're going to do an employee program, we will do that. But working with you guys is what I want to do.
Can I
Anybody
jump
else?
in?
Yeah, go
James,
ahead.
I think, Bonnie, your question is like remarkably, like that's how I got into this as well. I mean, it was initially thinking it was going to be a workplace wellness initiative, but because I'm also a holistic nutritionist, like I'm an RHN in Canada, exactly what you're talking about. So functional medicine, I don't do it probably as much testing as a functional medicine doctor, right? But as a nutritionist, I have access to certain testing. But it's always been what I found is a challenge talking to people about stress. I didn't have the right tools to be able to say to them, like, I mean, yes, we've got our kind of a toolkit, like, use some essential oils, use some of this, try some meditation. But there is a gap between helping them understand how much their stress is affecting them for them to take that seriously. And
Right.
I found the SMQ has been absolutely phenomenal. I think all of you that have talked to so far as well, even have remarked, like, I didn't realize, these particular things were actually adding to my stress. I know when I did my call with Lorene, and I know she wrote about it in one of her emails, it was eye-opening for her. So as a personal awareness tool, it helps them take it more seriously and be willing to start addressing those things.
In
Because
addition to that, Mel, it enables the coach who may not be trained in the background of providing information about stress, gives them a way to segue into that area. For example, as you well know, how stress and cortisol affects weight. There's a huge amount of data showing that people who are stressed out gain weight for good biological reasons. So if we can help them in some way to understand that relationship exists, and then what to do about it, and ways to bring it down, and that's really important. And the other thing about stress mastery in my mind is this: why I changed from stress management concept to stress mastery is because I wanted to get into the cognitive side. As a psychologist, we know when people come to us for serious problems, we're constantly working on their cognitive processes, how they perceive, talk to themselves, look at the world, make choices about what make or don't make choices about how they respond. as in the automatic negative responses that we all have. Something happens, boom, but I go downhill. I had that just happen today with somebody, and it was like a lightning bolt went off. Something happened, and she went, boo. It was automatic. So we want to help people understand that, because if you don't understand that, you don't recognize it, you can't change it, as you just said, Mel. It's kind of a cornerstone of my belief.
Yeah. And I think one of the other key points as well, which one of the reasons I really love this program is it's written by you. It's written by a psychologist, validated by the National Institute of Occupational Health and Safety. It is a self-assessment tool, basically, and you have the guidebook, which gives you enough simple to understand and applicable things to try on in different areas of the types of stressors that we have. And the key thing here is I could have researched all this stuff to death myself, but I need to be careful as well with my scope of practice. I'm not a psychologist. I'm not a psychotherapist. And this gives me a way to address stress at this, at the base level. If there's something more serious going on, of course, refer out, for very serious, massive issues. But at the very fundamental levels that everyone can understand, like on the same playing field, these are the most useful I've ever found. And it's been life-changing for some of my clients too, just having this awareness or having a different method that's, really well thought out, well researched, and successful. I mean, there's over 30 years experience now with this, and so it works. And again, like I said, I don't practice psychotherapy. It's in a coaching method only, and the tools are written by Dr. Petersen. So then it allows me to stay within my scope of practice, but still give them something very, very useful to do.
Let me ask a question of the group. I'd like to know from the group, is anybody doing, or any of you doing group programs where you might be using, doing something which might be long-term with a larger group, even 10, 15, 20 people? Anybody doing group work?
I may be doing some group work. I work with the Dutch testing. I work with women's health and hormones also. So this taps right into it with the cortisol, because it always gets down to, I'm looking at all the metabolites and everything, and then the bottom line is stress. How do we deal with that stress that affects your cortisol? So this is fantastic. Would you consider this evidence-based? I mean, is that something?
Yeah, it is. I mean, I think it's certainly evidence-based, based upon the work and research that I've done.
Mhm.
The tools that we talk about in the guide are evidence-based tools. Are based upon very common psychological treatment tools, cognitive behavioral therapy, things of that nature.
Mhm.
I drew from all of the areas that I grew up and worked in. So yeah, so there's a lot of evidence from that point of view. So yeah, the group program, there are other aspects of this that I could tell you about. For example, when we do group programs, we also have the ability to share data with the company or the organization. So we can do aggregate data, we can do data analyses. We've done this for some fairly big companies in South Africa, and also here in the United States with one of the largest banks, where where I didn't take it, my associate took about 10 senior executives and ran her through multiple executive development training programs, of which the SAQ was part of it. And then we created a map, if you will, a chart of how the group looks. And we provided data that could come back to the group, which helped them look at themselves, because they were a cohesive group and they could take a look at different aspects of how and what areas really needed to be focused on. So
Sort of what Melody did in our class on Saturday, right? You did that chart, Melody, with all of us.
it's that, and that's one chart. The one that we do, the customized one, we actually go into the data And I personally I go into the data, I analyze the data and create a report. I'm happy to share that with you at any time we have an example. But again, I think my goal today is education about what this is all about, what we can do, how we can work together. And I'm excited the fact that you had so many great people go through the program. And looking at all your reports, it's a very diverse group. Everybody came up differently.
Yeah.
So that's a kind of a thumbnail. I mean, how deep you want me to go is really up to you. Any other questions that maybe people might have on their mind?
I had a question actually.
Okay.
Yeah. In terms of the licensing, like how long is the training? And I'm assuming it's online training that you give? Because if you're like, I'm also I'm kind of an integrative healthcare because I'm in pharmacy, but a lot of my actually healing from an autoimmune condition happened because of my own stress management. And so that's when I realized how important it is to offer this to my clients, but I don't actually have a system, or I really like the SMQ because it really makes them see, because when I see clients, they're like, yeah, there's a lot of stress in my life, but they don't really know, right? So I really like that, but I'm not sure. I mean, I've done wellness coaching as well. I'm not sure like how long will this training be for me to be able to use the tools that you have with my clients?
That's a good question. I don't do formal training like a long training program. What I do is I provide you with a variety of resources, and then I coach you as we go along, because this is not a complicated tool. I mean, it's not. It's straightforward. It's intuitive. So I think the training for most people, especially with professionals like yourself, is really short-lived. Now, I had been talking with other people about, well, why don't you do a long training program? Why don't you do a year-long program? And I said, you know what? I don't want to do that. The people already trained, and you don't have the time. So the answer to your question is, and I can show you the resources that we have that will help you. And Melody will tell you, and any one of my associates will tell you, I'm here for you if you need me. And that's my goal. So, but that's really key. So the license is perpetual, so it's one-time fee, and that's it. I provide you, and why don't I just share what the associate includes? That way we won't be talking about.
That's a good idea.
Stuff. All right, let's go here.
Yeah, I have the same question as Aziza. How long is it? Yeah. What does it entail?
All right, let's see. Where am I? Well, the best thing is just go into the resources and get this out of the way. So the way I divide this up is there are three tiers, if you will. There's the associate only, which has no marketing materials in it, because I found that some people don't need marketing materials.
Jim, sorry to interrupt. Can you just enlarge that to the maximum size for the students?
I will do that.
A little difficult to see. Thank you. And I'm just going to mute everybody else for now while you're talking, because otherwise it clicks in and out a little bit.
Let me then back up. So we already know that the SMQ is really called the Stress Mastery Program, and it includes the link to take the SMQ. You would get 15 access codes up front for each person that would be provided to the individual taking the SMQ. After completing the SMQ, I send the stress report to you so that you can then present it and work with the client. We do have a variety of approaches. We have English and Spanish. We've got a Christian and we've got a new Jewish version, which was helped by a rabbi who said, I want to be able to use this with my parishioners. Then there's a stress mastery guide, which you've already seen. So that's the core program. There is also a stress mastery workbook. Now the workbook is really neat because what it does is takes each of the 11 scales. And let's say you had a client that was pretty high in one or two areas, or you felt that maybe those are the areas that you wanted to focus on. You could then provide them with one or more of the exercises in the workbook. So I can show you all this in detail, but giving you an overview here. And that's good because once you've got somebody who scores high on burnout, then it shows them the questions and really asks them to think about, what does this have an impact on their lives? Why is it there? What can they do about it? And that provides a way to have a discourse and discussion with that individual. So that's part of it. There is a facilitator's manual, which is about 143 pages. And this describes each of the scales, talks about setting up programs, kind of lays the groundwork for what you might want to do, whether it's training or coaching or both. And then there's coaching and mentoring from me as part of it. So that's kind of the core of what is provided. For the resources for associates, again, depending upon your language, there's a variety of them. You'd get all the training manuals and materials, all the resources, the PowerPoints, PDFs, videos, articles, Word docs. You would get how to conduct a stress mastery workshop, which was a webinar I did with some associates, talking about if you were to do a stress mastery workshop, what would it look like? What would be included, how, and the PowerPoints are provided, and there's a lot of information about that. So if you wanted to do a workshop, and again, you can integrate these workshops to the health and wellness work that you're doing. So it could be part of that. It doesn't have to be a standalone. In fact, the more that you can integrate into what you're currently doing, the better. There's a whole section on how to use the SMQ in a corporate training program. For 6 years at Citibanamex, over 500 or 600 people went through a program from Stop at Nothing, which is an associate of mine, and they really benefited a great deal. It was just terrific. Then a little bit about that. There's a thing about through COVID, through stress mastery through COVID, which is almost now passé. How to change automatic negative thoughts is a whole exercise and worksheets on that. Mastering stress, a guide for correction officers, should you be in that area. There's a lot on coaching. How to use the SMQ when coaching in a company. It's a video. How to use the SMQ in coaching or counseling. It's also a webinar videos. Plus there's other resources. So when you get into the marketing side, there's a whole variety of things that would help you if you needed help in your marketing. And you can see that there's quite a bit. There's particularly important is the how to create a communication plan and marketing plan. I have found, I had another company that I managed for 20 years, which was an advertising company. I'm absolutely convinced most people have no idea how to do a marketing plan. But you can do a simple plan that helps you keep on target for where you want to go. And I think that's what I want to do. I want to give people the resources to help them stay on the course that they want to put themselves on. So if you go into all of that, there's a lot more resources in there. So in terms of pricing, everybody wants to know that. This is a letter from the American Institute of Stress. I've been working with them for 5 years. We've done hundreds and hundreds of people who have taken the SMQ through the American Institute of Stress website. So if you go to stress.org, the first thing you're going to see on there is the SMQ. And people can take that and they sell it to the public. And that's an experiment of mine. It's worked out pretty good because it really has helped a lot of people. Okay. The affiliate license, this is the first level. This is like if you don't want all the materials, you feel you just need to get the access codes, the reports, the guides, and the facilitator's manual. It's normally $4.94, it's $4.49. That's a special rate. So basically, if you just wanted to become an affiliate, you'd get 15 access codes, 15 stress mastery reports, of course, access to the guides, and also I should add the workbook and the facilitator's manual, which is a really good deal. So that's a basic one. I don't encourage it because I think if you need the materials, you should go to the associate level, but it's really up to you. At the associate level, I'll put this in bigger. Marketing materials are not included at this level. And at this point, you get the 15 access codes and the facilitator's manual, all the materials on how to conduct a workshop, corporate training workshop, and how to use the SMQ in corporate training, how to change all of the materials I just shared is $9.95. It's really all of our people have been paying a lot more, but because of the Melody and our work with her and your group, I decided we'd put that at a reasonable price. Then, if you need marketing materials, and there's quite a bit here, then that's another $9.95. Altogether, it's over $3,000 in value. We put it at $1,900, $1,990. So you can get everything for $1,990, or you can just parse it out and just say, I just want to become an associate. By becoming an associate, I would send you an agreement, a license agreement, which is very straightforward, spells out the relationship between us, and that's it. So that's the bottom line. It's basically become an associate, become an affiliate, or get the marketing materials. Any questions?
I actually had a question.
Okay.
So you get the 15 access codes, right? So that means you can use that for 15 individuals.
Correct.
Then when you have more clients, how does you buy still the same program again, or?
No, you don't. They're $19.95 each. So we sell them in lots of 10. So it'd be $190, and you get 15 access codes or 10 access codes. So whatever you need, if you're doing a group program, and let's say you had a large program, we would talk about maybe a little bit better price, but we sell this to corporations anywhere from $45 to $75 per employee.
Okay.
And by the way, I have 2 other pharmacists who are associates.
Oh yeah.
I do. One is
Is
Jennifer.
it in Canada or is it?
One's in Canada.
Yeah.
And the other one is in Dallas. Her name is Jennifer. And Jennifer is a clinical pharmacologist, and she works for a large corporation. But like you, she's very interested in, and particularly working with women. And so her focus is on helping people with stress. But she's also worked with a lot of other pharmacy students and has used it in her program. So she's a great resource. And that's the other thing I would like to say to everybody is that there are people that like to collaborate and want to collaborate, like Melody will be a good example of that, where let's say you want to do a program together, or you want to just talk about each other. I'm happy to connect people together so that we can all learn from each other.
Mhm. So can I just get clear again? So there's no specific training, right? You just pay for either an associate or an affiliate level. Is that correct?
Essentially so, except that I do coach you. So let's say,
Okay.
as I said before, you say, Jim, we have a conversation about a program I'm doing.
Okay.
How would you put this together? How would you sell it? Let's say you needed work in putting together a proposal.
Okay.
In the marketing materials, there's 3 proposals that you can use and modify to use and take it into a company or organization to share it, or you can modify it, add to it in some way.
There is the 145-page facilitator's manual though too. That is where I think the most fundamental basics of the training is, because it really dives deeper into understanding and explaining the SMQs and how to go through and create say like a webinar, like what you would do in training with corporate and with clients and that sort of thing, groups. Like there is training, but it's not formal.
Is that on Melody? Is that on both associate and affiliate level, or just mostly the associate level? That manual, the facility.
No, it's for both.
It's for both. Okay.
For both. The other thing is we're going to be doing webinars periodically.
Mhm,
So for example, next month is a Stress Awareness Month,
mhm,
and we have a big promotion putting together that we want to reach out to the business community primarily through LinkedIn, primarily through communication, articles, information, things of that nature. And then provide companies, for example, we can provide that same package I just shared with you to a company who may want to use it with their employees. There are companies that have internal trainers who are really pretty
Mm.
well trained. They
mm,
don't need a lot of help. They just want tools.
yes,
And so, like, for example, 7-Eleven, used to, or back east, it's called Speedway. Uh,
uh-huh,
Speedway, we've done thousands of their employees over
Mm.
the years.
mhm,
Unfortunately, they were bought out by 7-Eleven.
right,
So,
right,
so we're still waiting to see what they're going to do next. But again, I see lots of opportunity depending upon what your own goals and needs are.
mhm.
You know, I can share and to any of you, I can share you an example of the agreement so you can look that over.
Yes, that'd be great.
One example I've also got too is I used the Stressmaster piece with an executive wellness program. I don't know if I mentioned this on Saturday.
Mm-mm.
I had a contract with a hospital in Ohio actually for just at the beginning of COVID, and there was 12 executives, and there's three of us. We collaborated on putting together a wellness program for them, and it was also about their company culture, so healthy workplace culture and that sort of thing. And very quickly at the beginning, we realized how big of an issue stress was for this team. Just the way they ran their day-to-day lives, like their business, and I mean, it was off the charts. And when you think about these were like 80% of them were doctors and nurses,
Mhm.
and they were running themselves into the ground. Like, and I'm not kidding, like they had a lot of them had very serious underlying, let's just say their labs would have
Yeah,
been concerning to a lot of people, but they also had, just very unhealthy day-to-day scheduling and just how much they were trying to cram in and not eating,
Mm.
not getting any exercise, not even taking a breath. And so this became a fundamental piece of what we were talking to them about. If we didn't have you know, the core basics, like helping, like the SMQ was a real eye opener, right? Because they needed that mirror reflection to say like, oh, okay, yeah. And so in our one-on-one coaching with each of them, we customized it, but then in the group coaching, it was a little bit more general, but to really emphasize the point, like, this is serious. Like, I never want to ever have people say in front of me again, it's just stress.
It's just right, right.
Like, the word just never belongs in that sentence. And it
Mhm.
was very, very helpful to them. So I've used this in a number of different ways, and
Mm.
it's very flexible. And I think that's one of the
I shared with Melody the other day, and we talked about it. As a market area, the problem in healthcare is enormous.
Mhm.
Over 400 physicians commit suicide each year.
Oh,
Yeah.
yeah.
It's so the need is there, and there's more of a story that I'm not going to get into now, but I'm very aware that if you're in the healthcare business and you can work with organizations and healthcare companies, this is a great place to be for all that you provide, not just the stress work. It's a huge
Melody,
need.
are you an associate, Melody? You're an associate? Yeah.
She is a premier associate.
Premier.
She's one of my,
Would we have the opportunity to learn from Melody also if we were doing this at the associate level, or, yeah?
collaboration is, Melody would be the first to tell you, we all collaborate. I shouldn't say we all, some people don't want to collaborate,
Mhm.
but there are many, many that do.
Mm.
I've got a psychiatrist right now who's looking out. She wants to talk to people. She's got a practice that she's doing. So yeah, there's opportunity to learn from each other. a great deal. And as we learn about programs that we're providing and share what where each person is doing, for example, Tariq in Saudi Arabia, who's actually from Lebanon, he works for Medtronics, but he's passionate about helping people with stress. So he's working in Saudi Arabia, and he wants to leave his job. He has put an enormous amount of money into, well, the SMQ is part of it, but he's developed a VR program, a virtual reality program using state-of-the-art virtual reality where you can actually immerse yourself into a oriental concept of mindfulness, deep breathing, deep relaxation. So you put these headsets on and you're in another world. And then the idea is this is one way to help people bring levels down. It doesn't solve the problem, but it's part of his tool bag of what he's putting together. So, and he's also developing an app. So I see people like that, they're always looking to look for others to kind of talk to and learn about what they're doing and how we can work together. So I'd love to have any of you come on board, and I appreciate that. Josephine, I don't see you. Have you have any ideas too? And Jennifer, do you have any thoughts?
Well, I'm currently in another course. This is very near and dear to my heart, literally, because stress got me. It got me in a big way. I've got stents in my heart, so it got me huge. And then my experience through the medical is, it's not in a good place, because they will say things like, they did have a little bit of a mindfulness. University of Toronto had some students come in and do some mindfulness. Now you got to understand, you got these kids in the room, and you've got people who are, 60s plus, not talking the same language, and they're trying to tell us, you're sitting there, you're being mindful, whatever. People were falling asleep. They just didn't understand the whole thing. So, and I was I know my stress now, and I've changed like tremendously. And so I'm taking now actually another course, the mind-body connection, and dealing with the old beliefs and releasing that all out of the body. So this sounded very interesting. I just cannot at this very moment do another course or do something else while I've got 6 months down the road, and then I can look and see where I'm going next. But I see my daughter is an ICU nurse, so I see tremendous value in all of this. And if there was at one point I thought maybe I should do things towards people with cardiac, because they're not really taught any of this at all.
Right.
And there's that kind of thing. The other part that I was really thinking, because I'm watching people that have family members that are addicted, they are tremendously stressed out. Myself, I am in that position. My daughter has gone down a path. She's trying to climb out, but that from a parent's view, it's devastating on us. And you get so stressed out with all. So those were the two main things that I was interested in with this. I'm not quite sure how to put this all together, but it's certainly, what I liked was the structure, and you actually had a tool in your hand. So for me, right this very second, the timing isn't great for me, but when I'm finished this, I would love to be back in touch. So that's kind of where I am. But I have to be honest and say that right this very second, I appreciated the quiz and looking at this stuff, and it's like, oh wow, this is great, this is good stuff. However, for me to get, and my instinct is I would like to do something, but right now I can't put any more stress on myself.
Now just relax now. Take a little break.
Yeah, exactly.
We're fine.
Exactly.
We're fine. We're good here.
Can I share something really quick?
Breath.
I just want to share something really quick on the cardiac stuff. That one's very near and dear to me. It's not my area of specialty in my holistic practice, but my mom has had a long history of cardiac issues. She's got AFib, she's had valve surgery, she's got high blood pressure, I mean, you name it, but she is also a professional worrier and stress.
Yeah.
Mhm.
I probably learned a lot of it from her. But some of the tools that I've kind of gleaned out of the stress mastery piece have been very helpful for her. I've also taught her breath work. I've also taught her, but with all of these combined, she now manages. Okay, this is the contrast. Her doctor for what, 30 years was telling her, if you go into AFib, call the ambulance.
Hmm.
Okay. And so
Wow.
then she'd get rushed to the hospital, and all they would do is like stick monitors on her and do absolutely nothing for
Nothing.
her.
Exactly.
I have taught her how to calm things down and re-regulate everything within usually it's less than 5 minutes, 10 minutes.
Yes.
She can re-regulate. I mean, I tell her go get some magnesium and some, but she's got her toolkit now, and a lot of this during the day is about her thoughts and
Yeah.
all of this. It has been so
Yeah, those thoughts
helpful
are,
for her.
those
There's
thoughts can
no
be
more
really bad.
of this 911 stressing herself out even more nonsense. She has control now.
And it's a
Well-
huge,
Well, both
It's
of you identified one of the key issues, which is that there are many people who refuse to take responsibility for the way they think and how they respond.
Yes.
They want to put it off to other people. They
Mhm.
don't want to own the fact that what they're thinking does affect them. And so understanding that this is why I've seen this happen many times where people have taken the SMQ and then they have that aha. And then a coach and a counselor can work with them to say, okay, you understand this now. Well, what's the next step?
Yeah.
How do we inoculate yourself? Go into inoculation phase. And that's really helpful. I have a joke. Do you know how many psychologists it takes to change a light bulb? One, but the light
One.
bulb has to want to change.
All right.
yes.
And we
That's
all
right.
want clients who don't want to change.
No, it's
And
what
I-
are
and I-
people
when I was-
willing
when I
to
was
do?
doing-
What are they
Go
willing?
ahead.
I was
Yeah,
gonna say,
but
I always ask my clients, what are you willing to do? You say you want to lose weight, you want to do all these things. My question is, what are you willing to do? Yes, they
Mhm.
come and they say they want to change, but what are they willing to do?
Mhm.
Right.
Yeah. I
Yes,
also
absolutely.
just want to say that I work in a group with other mental health professionals. So I think
Okay.
this would be amazing for the therapists that are in my practice here.
Well, we can talk about how to
Yeah.
help them see it. I'm glad to work with you on that. We could, for example, provide them with they could take it
They
themselves.
could take it,
We
yeah.
we could have a little conversation about with the group. So
Yeah.
that would be that's how we could work together.
Right. But I also really wanted to think about how I'm going to work it with my clients because I do a lot of functional lab testing. I'll just do, basic labs. I do Dutch, I do GI map, but everything always comes down to stress. It's
Always.
underneath Melanie, you and I talked about this. It's underneath everything.
It was the fundamental thing, I think, why my fibromyalgia got so severe. My
Yeah.
HPA axis was
Yeah.
stuck.
Yes.
Everything was stuck and
Mhm.
dysregulated. I mean, I wasn't getting any sleep. I mean, everything.
Yeah.
And it had been like that for a long, long time as well. But that exactly. I mean, that's why I say don't ever use the phrase "it's just stress."
Right.
It's
Because the dysregulated
It
nervous
is
system, people are
so-
in that sympathetic overdrive.
It
And I
is so
see that,
huge.
yeah, how it impacts everything. And the whole idea about functional medicine is, as we talked about, is very much interrelated with everything. We're not soloed. Each system isn't separate. It's all interconnected. Yeah.
But I find,
Well, it's-
with clients, it's really helpful to do this piece of it early on.
Okay. Early
Consulting
on.
with them, because
Yeah.
here's the thing, you can design all the fancy food and supplement protocols you want.
Right.
If if their nervous system's so jacked up and they're so
Yeah.
wired, they're going to have trouble following it. And even
Mm.
if they do follow it to a T because they're trying really hard,
Mhm.
they're stressing themselves out even just trying to do it.
Yeah.
if, when you make the connection with them about how important the stress piece is, that
Mhm,
protocol and
mhm,
the synergy between them learning to kind of change certain behaviors, the ones that are like the biggest triggers for them anyway, the ones that they can have control over,
mhm,
the synergistic effect is their results are going to happen. The physiological results happen that much faster and
Yes.
easier.
That's
You're
beautiful.
not fighting it, right? Like they just blend together so beautifully.
Mhm.
And so, I mean,
Well,
I would say
I think the
most of
idea,
my
I think
clients, you have to do that. Yeah.
the concept of integration that you all have talking about is we need to take that to a broader level.
Mhm.
And as you know, Melody, I work with Lisa Kelly with the Kelly Wellness Institute. She does wellness training.
Mm.
And she
She's
certifies
workplace wellness training.
Uh-huh.
workplace well.
Wellness training. Yeah.
And you went through her program.
That's how I met you. Yes. Yeah.
Oh,
That's right.
wow. Where is she, in Canada?
Yeah.
Mhm.
She's in Calgary,
Okay.
and she and I worked together. She is a tremendous advocate of the same concept we're talking about today. So many of her, like Melody, there's several other people who have gone through her program. It's a year-long program. It's very intensive. It's very good. So I think we're talking about how do we change our own culture of working with people, the medical culture, the health culture. You know, for example, my wife she's got stents like you, and she's on medication for high blood pressure.
Mhm.
She's spiking in the
Mhm.
middle of the day for those. I mean, I watch the stress with her. I mean, she can be stressed out like anybody else. She could be in the middle of the night, and all of a sudden it spikes.
Wow.
The cardiologists have no idea what to do about that. I mean, they can prescribe clonidine or whatever they want to do, but
Right, right.
we're not getting to what the real problem is. So so now I'm having her look at some other alternative work, like with you guys, like people like you.
Mhm.
What's the metabolic function? What's the adrenal
Right.
function? What's going on here?
Exactly. Metabolic,
And,
yeah, totally.
and so who
Yeah.
knows? We'll all be talking here about how we can help her. But I mean, the cardiologists to a person are just they're all over the map. One said to
It
me the other
doesn't work.
day,
Yeah. My
Exactly.
husband had a similar thing. He has AFib and yeah, and they prescribe Klonopin. He's on a drug for AFib, and then that creates other issues with his thyroid and
oh,
blah.
it's
Yeah,
back and forth. Oh, it's
yeah,
terrible.
it's just a mess. Yeah.
Yeah.
Mm.
Saw the same with my mom. And the same, and that's the thing, the drugs don't actually work. They
Well, they're
may
just
model
band-aiding the
it.
symptoms. Yeah, they're not getting to
But
the cause.
it's very scary to take yourself off those drugs. I mean, once
Oh
you're
yeah,
on
well,
them.
I'm not saying to
Oh,
go
I
off
mean,
them. I'm not saying that at
Have to
all, but
go
I'm
off.
just saying they still have the issues.
Absolutely,
The
100.
issues still
And
happen.
And
So
Dr. Petersen, you know, I mean, even if you are taking those SSRIs, that has a whole other, that's a
Oh,
problem.
yeah. She's got brain fog. She's got all kinds of issues. Yeah,
Yeah.
I see it. So we're on a path to find some alternative ways. Look at it. Now I got her on beet juice and she's on Q10, anything to help,
Yeah,
anything to help her heart.
right.
But you know, it's complicated because
It's
we don't
complex.
understand it.
Yeah.
We don't understand it.
Yeah.
And for myself, I'm a bit of a nominal. My cardiologist goes, wow. I mean, I'm on two medications just and one is just for cholesterol and the other one is a Plavix. And that's
So you're on a statin. You're on a statin, right? Are you taking?
no, I'm not on a statin. Repatha is not a statin.
So what are you taking for cholesterol then?
It's called Repatha. It's a different drug.
Huh.
And I can't take statins.
Yeah.
So I don't like statins. I had a part of my problem. I've had to have the stent surgery twice. The part of the problem was I got so stressed out because I had just graduated from CSNN and I was just a holistic nutritionist. And honestly, I graduated on Sunday at the ceremony, and then on the following Friday, I was in the hospital.
oh
Oh my
no.
I
God.
had no idea, but the year was very stressful, and that was the accumulation. Plus, I had a retail business, and I was doing way too much. And I mean, and for me, I went back to school at 59, 60. So it was a tough
Yeah. Yeah.
go, but I was so terrified of the drugs. That made my stress. So that's what really upped me, was my whole attitude after the event and going forward, because I was terrified. And that just sends your drugs. I watched my parents be on 9 million drugs, and all the effect. You take this to fix that, and then you have to take something else to counteract the effects of the drug that you're taking, and on and on and on it goes. You mean they're taking 10, 15 drugs a day, and I'm going, there's no way. So I have a very good cardiologist, and he says you have to take one for the year after they did the stint. If you won't take the one for the year after the stint, which was to stop it from clogging up or clotting or whatever that they do, that was, I agreed for the year.
Okay, well, I'm
And then
glad
I
you
had
we
to
all
back,
agree.
and I wouldn't even take the cholesterol, but then I had to back off. I tried for a bit and then I couldn't. But when it happened the second time, I had to make some concessions and be okay with the concessions.
I know we're going to run out of time, but one thing I want to mention is the epigenetics work
Yes.
being done
Yes.
today.
Yeah.
And I'll give you my story because it's relevant.
Mhm.
When I was 18 years old, I was playing tennis in a Chicago Parks League. Hot, it was 100 degrees or 95 instead of humid for 2 days. I got dehydrated, and I felt, I think I had heat stroke. So I didn't feel good, went home, went to bed. I felt terrible for 2 days. 1 week later, I couldn't walk.
Wow.
So what it turns out is I have ankylosing spondylitis,
Yeah.
AS. AS has a genetic marker.
Yes.
And I believe the physical stress of going through this triggered a change in that gene. I can't say for sure that that's happening, but I think the evidence is so clear that between the exhaustion and what I went through and not being able to walk, I mean, my knees were like balloons.
Oh.
So, and I've had this my whole life. So then I learned to regulate and deal with it from, just, you've got to keep moving, you got to keep positive and, keep the body going. And I'm fortunate I'm pretty healthy.
It's an autoimmune condition too. You have to,
Yes, it is.
support your immune system. Yeah. They didn't put you on Humira or any biologic or anything? Good.
Back then, no,
Yeah.
they
No.
didn't
But
even
now
say
that's what they do. Yeah.
Well,
Yeah.
that's the
I'm on
thing,
that.
like
I
so much of it you discovered was regulating your nervous system,
Mhm.
right? So same
Yeah.
thing with fibromyalgia, same thing with a lot of these other ones,
Yeah.
right?
Even Hashimoto's, Yeah. Yeah.
Well,
So
what I'll do is to make it kind of give you a closure, I'll send each of you an example of an agreement.
Okay.
I'll send you the pricing so you'll see exactly what we're talking about.
Great.
If you want to go forward, just send me an email. We'll get started. And then what I do is I'll send you an Excel sheet with the access codes, a link, a certification, or you'll get a license certification thing to put on your wall.
Okay.
And the links to all the resources, which I'll send you the resources so you can see what is in there. So you'll have a pretty good picture of what it's all about.
Wonderful.
And
That's great. And if we have any questions, I guess we could check with Melody on that, or,
call
you.
me, just
Yeah.
just call, send me an email.
Okay.
We can either talk on the phone, or if we need to Zoom, if it's gonna be longer, we want to have a Zoom call, that's fine too. Just let me know how you'd like to work it, okay?
Okay.
I'm for your introduction to the expert. So, but if you have questions for me about my experience with it, sure.
Yeah. Yeah.
By all means.
Talk to Mel, she knows more than me.
I may talk to you, Melody, because we have very similar kind of practices. So
Sounds like it, yeah.
I don't know how you integrate it within your practice. Yeah, that's my real issue.
Oh, it's as simple as what I just
That's
told
what I
you.
like. It's simple. I
It's
mean, it's not
very
like I
simple.
just finished a 3-year training program for, the School of Applied Functional Medicine. I just don't have the stamina to go back and do some. And I actually, Jennifer, did this when I was 70. I'm 74. So it was not easy.
Doing well.
It wasn't easy at 70, but it was during the pandemic and I had shut down my practice and I thought, now's the time, because I was home, so.
Mhm.
Yeah, at
Fantastic.
any age you can, if you have a passion, right? I mean, it took me a
Right.
little longer than somebody who's 25 or 35 or even 50, but I did it. So
Well, the passion is what really drives people.
The
I mean,
passion.
if we don't have a passion or
You
some
can't.
goal,
It's
you know,
not
we just
sustainable.
wallow.
I agree.
And Jeff, you can come back at any time if you ever want to use the SMQ. We can talk about just picking up some and using it, but take your time whenever you
Okay.
feel it's ready to come back, and Bonnie will be in touch, and anybody else who would like to join, we'll have a great time together.
Okay, that's
Yeah.
beautiful.
Like
Thank you.
Jennifer, if you don't want to take this on like at an associate level, if you just want some, support and coaching from, that would be, you could just do that through me. You don't have to like buy a license and do all that. You can just do that through me then, and we can kind of pick up when you're ready, and probably need to do the SMQ again, but we can just kind of evaluate where you are and then take one piece at a time. You know what I mean? And that's sort of working like an accountability. What do you want to do next? And that sort of thing, like coaching, right? It's just,
Yeah.
it's
All right, well, thank you
All right,
guys
so
so
we'll have
much.
Thank you so much for your time, Dr. Peterson. Appreciate
It's
it.
my pleasure, and good luck to all of you. And if you have any questions, feel free to email or give me a call. Okay?
Great. And Melody, thank you again for setting this up. You're terrific.
Thank you so much. Thank
Yeah.
you.
Yes, you
Really
are, Mel.
appreciate it. We'll be in touch. Okay.
All right,
Don't give her.
great.
All right.
Thank you so much. All right. Good
Bye.
rest of your day, folks.
Bye-bye.
Jim, do you want to hang on for a minute?
Yeah, sure.
Yeah.
Okay.
Oh,
all
go
right.
ahead. Okay. Bye, guys.
Thank you. Bye-bye.
Bye-bye.